pleased to be here today, introduce the T-COPPE video, and also to represent our T-COPPE team. T-COPPE, and there is not going to be a test later, don't worry, but T-COPPE actually stands for the Texas Childhood Obesity Prevention Policy Evaluation Project. Now you know why we abbreviate the name. Much easier to remember and to share. Funded by the Robert Wood Johnson Foundation in 2008, Texas, or T-COPPE, is actually one of only 6 state policy evaluation projects that the foundation funded. And this 5-year project involves the evaluation of 2 national childhood obesity prevention policies as those policies are implemented in the state of Texas. Those 2 policies are the Safe Routes to School and the WIC Healthier Food Option Package. At the moment, we're in the midst of our post-data collection. So while we made some interesting discoveries in our pre-policy initiation data collection, and we'll be sharing some of those findings with you in the video you're about to see, please understand that there is much more to come. So make that a ... We have several important partners working with us to help this project happen, 2 of which are here, Texas Health Institute and the Texas Department of State Health Services. Those groups have been very helpful as we work through this project. But I would be remiss if I did not also acknowledge the cooperation of the 81 schools and 112, I have to stop and think each time, 112 grocery stores across the state of Texas that are involved in our project. That's quite a number, and we really just couldn't do it without their assistance, so acknowledge that cooperation. I do want to make a point that T-COPPE is rather unique in another way. It is a very strong collaborative effort between 2 large Texas universities that I think people would probably admit have a fairly well-documented history of strong rivalry, and that would be Texas A&M and University of, I was afraid someone was going to do the whoop, but and the University of Texas. However, one clear learning that we realized early on, there is no rivalry when our focus is finding the healthier option for our children in Texas. Please feel free to speak with any of us on T-COPPE after the presentations if you have any questions. But for now, just join us as we look at this issue through new eyes. The T-COPPE
T-COPPE is a 5-year project that's actually looking at 2 statewide policies. Today we're going to be focusing on Safe Routes to School. What Safe Routes to School does is it focuses on 5 different aspects, and we call them the 5 E's: engineering, education, encouragement, enforcement, and evaluation. So for example, it will have funds for safer environments, whether it's sidewalks or crosswalks, and it also teaches kids about traffic safety.
3 years ago, when I started as a parent support specialist here, Safer Routes to School just landed in my lap. It's grown into something amazing. I have about 15 to 22 kids that walk with me on Wednesdays. It really has spurred relationship building and conversations that have evolved into making sure that the kids get safely to and from school.
During our baseline data assessment, what we found was that kids were more likely to walk if they were in an infrastructure or a planning school than they were in the control schools where there was no funding for Safe Routes to School.
One of the very exciting things about the T-COPPE project is that we have an opportunity to influence public policy. We have held events at the state capitol, we have prepared policy briefs, and we have connected the project to key stakeholders such as Bike Texas and other members of Partnership for Healthy Texas.
Safe Routes to School is so important. It's brought two rival universities together.
We have Texas A&M
And the University of Texas.
And Texas Health Institute supporting the communication and dissemination.
It's a great team.